Hey, I'm Sachini. I'm going to talk about the Treaty of Waitangi and cultural safety. According to history of the Treaty of Waitangi, it is New Zealand's founding document. It is an agreement that made between British government and 540 Maori Rangatira on 6th of February 1840. In the late 1890s, the significant number of British migrants came to New Zealand with the long-term plans of settlements. They made lots of deals for lands with Maori people in New Zealand. So the British government was trackful for annexing Maori lands by signing an agreement with the local New Zealanders as protecting Maori population. So that agreement was known as the Treaty of Waitangi. When it was translated into Maori language, it was distorted as well as it was a great opportunity to British government for taking beneficial actions that led to Maori losing much of their lands as well as it affected for declining of their social, cultural and physical well-being. As a solution for this, the Waitangi Tribunal was established in the Section 5 of the Treaty of Waitangi Act in 1975. The Waitangi Tribunal makes recommendations relating to breaching the promises made in the Treaty of Waitangi. According to the principles of the Treaty of Waitangi, there are three principles which were developed after court case in 1987. Such principles are partnership, participation and protection. Ministry of Health in New Zealand has developed Maori health strategy depending on these three principles. First principle is partnership. That means working closely with Iwi, Hapu, Whanau and Maori communities to develop plans in healthcare and disability services to gain better Maori health outcomes. Second principle is participation. That ensures participating in all levels of healthcare decision making, planning and delivery of health and disability services. Last principle is protection, that makes ensure that the Maori having at least the same level of health benefits as Paheha. Moreover, it actively protects Maori cultural beliefs, values and practices. According to nursing responsibilities to uphold the Treaty of Waitangi, first one is nurses must work with Maori with the mutual aim of improving health outcomes. To achieve this, we have to provide quality care as protecting faith between nurse and patient. Then as nurses, we can plan the care according to common purpose, interest and cooperation to gain better health outcomes. The second responsibility is nurses should not be biased in decision making, planning the care as well as delivering it. Third one is promote Maori empowerment for gaining positive health outcomes in the Maori community. The fourth responsibility is nurses must respect and protect the Maori cultural beliefs, values and practices. The last one is encourage Maori people to adopt healthy and safe lifestyle by facilitating the equal opportunities and accessibilities in the healthcare and disability services. As health professionals, if we provide quality care according to the Treaty of Waitangi, we have to pay great attention for Maori culture as that population has a strong cultural background. So according to Nursing Council definition, the cultural safety is the effective nursing of a person or family from another culture and is determined by that person or family. The pioneer of the concept of cultural safety was Irihapitik Ramsden, who was a Maori nurse. So cultural safety that was adapted by Nursing Council in the 1990s and included in the nursing curriculum. According to the process of cultural safety, it begins from cultural awareness, then move into cultural sensitivity, finally into cultural safety. According to principles of cultural safety, there are four principles in the nursing profession. So first principle is aims to improve the health status of New Zealanders and applies to all relationships. This can achieve by respecting beliefs and practices of a specific cultural groups. Second principle is enhance the delivery of health and disability services through a culturally safe nursing workforce. Under these, we can identify the bond between nurse and patient, then empowering the users of services. Third principle is cultural safety is broad in its applicants. In here, especially recognizing inequalities within healthcare interactions. The last principle is cultural safety has a close focus on understanding the impact of the nurse as a bearer of own culture, then challenging nurses to examine their own practice, balancing power relationships, and power imbalances can be examined, negotiated, and changed. Actually, when we practice healthcare profession in New Zealand, both the Treaty of Waitangi and culturally safe practice are very crucial. According to nursing profession, competencies outlined in the scope of practice and nursing council's code of conduct both require that nurses must provide culturally safe nursing care, as well as they should have an ability to practice nursing in order to the three principles of the Treaty of Waitangi. So actually in nursing homes and hospitals, different people come from different communities, religions or race with different beliefs, practices, values. So as nurses, we have to respect for all them. So as examples, according to Maori culture, they conduct karakia, that means blessing, for enhancing better spiritual, physical and mental health. Most of times when Maori patient is hospitalized, such karakia is conducted for giving mental and physical relief for that patient. Therefore, we have to correctly understand the worth of that cultural practice for the patient and his or her family. Then we can offer and facilitate supportive environment for conducting such karakia. In this way, we can work as improving faith between nurses and Maori. So it will be a great opportunity to increase Maori awareness for gaining more opportunities and facilities available in the healthcare and disability services. Moreover, according to my nursing experience, most of Muslim women try to wear their black abaya even they are hospitalized because it is a part of their culture. Actually, it is a barrier for providing quality care. In here, as nurses, we have to balance both sides. So firstly, we have to closely work with such patients as creating mutual rapport. Then we can find solutions for that problematic situation by creating good awareness regarding their cultural practice. Further, we must clearly recognize the interaction between cultural practices and them. Then we can provide proper explanation regarding the importance of wearing light dresses during hospitalization. In here, we must not be biased. So I think if this explanation is done by one of Muslim healthcare providers, it will be more effective. According to my personal view, I think both the Treaty of Waitangi and cultural safety are crucial for making a strong bond between nurse and patient to achieve positive health outcomes, as well as it significantly affects for reducing health inequalities in New Zealand. Thank you.